So let's get into it then. The question I think that a lot of people are dealing with is common rooms and activities for tenants. So there's a demand for that. Monique said that the team is meeting this week to work on a draft policy on the resumption of group activities. Jackie or Josh from your team, could you sort of share some things that you're thinking about now for how those might resume and some of the considerations you have? And then we can ask others to jump in and see if there's other things that they're doing.
Sure, yeah. You want to start, Jackie?
Sure. Oh, thanks, Josh. Well, we're starting off with coffee. That seems to be something that everybody's missing. So hopefully, once we figure out the social distancing protocols and figure out what our policy is, then we'll be able to move forward with that. But we definitely have a lot of interest for people coming out for that. Mm-hmm. Go ahead, Josh.
Okay, yeah. And so at our site, we're Concordia Village 4 in Winnipeg here. And so we're going to start with some outdoor groups. We usually have a walking club, so we're going to start that. We're going to be doing the screening prior to groups with clients. We've provided them with cloth masks, so we're going to just have that expectation that those are being used. Our community room is fairly large, so once people have a higher level of comfort, and obviously we'll be monitoring the numbers in the province as well. Once we feel we can kind of go to the next phase, then we'll get people happening in the community room where we have people at different tables doing groups that don't require shared objects. And then, of course, phase 3 would then be starting to have some of those normals back of maybe playing some games. We run a cooking class, so maybe finding a way to do that creatively where we can cook safely together. I know that's a group that is very missed by most people. Yeah, so kind of trying to approach it with different phases where we're following what's going on in the province, also following staff comfort level in facilitating groups, and then also, of course, client comfort level in engaging with us, because it's been a while since we've done it, and so there will be some anxiety probably for everyone as we kind of relaunch.
Thanks, Josh. That Monique said that she'll be starting the coffee group under the shelter in our public, I think maybe public room or public space. And Melody said that they've resumed morning coffee at both buildings with 6 feet between each resident. On nice days, they carry the coffee out to the patio. I don't know if everyone participated in the, it was a relatively small group, but we did have, it was aimed at PPE because there were lots of questions about PPE, but we do have a webinar along with a Q&A from Chantel, who is an infectious disease and prevention specialist with the WRHA. And she went through some detailed suggestions for coffee time. So you may want to check that out. She said, as a disease specialist, she said, go ahead and resume coffee time. You may want to consider staggering coffee time. So if it's typically, more than 25 people, you'd want to have different shifts. She also talked about using disposable items, making sure people clean their hands as they come in or sanitize their hands as they come in, making sure people aren't sharing things that they're touching. So if it's coffee, you maybe pre-pour the coffee or have one person pouring it so there's fewer touches amongst multiple people. Yeah, those were the main things she went over, but we have that on our website, so go ahead and read that. She had some good suggestions. I see. Okay, so Monique said community park, like you see at Assiniboine Park. Yes, I went to Assiniboine Park with full of papers yesterday, so there's lots of people out having activities outside together. I see Andre says that they haven't resumed any activities yet, so taking the cautious approach. Joanne, what about at Bethel Place? Have there been any activities or use of the common room?
No, there hasn't. We haven't been using our common areas at all. And it's part of the reason is we just don't have the staffing to facilitate the programming. And but yeah.
There's staffing for programming, and then I would assume also for cleaning if you're opening common rooms.
Exactly. Yeah.
Making sure you're cleaning the spaces. So you were asking about the outdoor spaces and chairs. Does that mean, have you removed your sort of your outside furniture, or how have you dealt with that?
Yeah, we've actually have brought back some of the chairs, not all of the chairs, and we place them 6 feet apart. And we're noticing that some family, when they come to visit, they're bringing their own chair for themselves to sit on, and some of our seniors just can't bring down their own chair if they have a picnic chair up in their apartment. And so we have put some out. We're doing very limited cleaning on them. And again, it's just we don't have the resources and the weekend resources to be cleaning chairs all the time outside. And we also have a few benches.
What I could do is reach out to Chantel to see if she has any advice about sort of outdoor chairs and furniture. I know generally she said in terms of sort of shared counter space, if you have an office open, for example, she was saying, you know, you don't need to clean it in between every single person who comes. You need to sort of set some points where you're trying to reduce the risk. So twice a day, but being reasonable with what you can do. So it might not be that you are personally cleaning the chairs between every person that sits on them.
Yeah.
Maybe you're having some sanitation supplies available for people so that they can do it, and having some signage, or maybe you're doing it at least every Monday morning and or every morning on the weekdays. So she was suggesting to be sort of reasonable in our expectations, because the risk of catching something from a bench is pretty low. I mean, they're not cautioning against public toilets, for example. So the risk is low, but there's also, you know, I think there's also an expectation that we try to do as much as possible.
Yeah, I was just a little confused because I've noticed some restaurants have taped off their outside benches, and I recently am aware of a building that serves seniors. It's a life lease, and they're not allowing any outdoor furniture in their outside area because of provincial regulation. And when I've read the phase 2 document numerous times, I just don't see anything around outside furniture. So we put it out, and then we thought, you know, we put some of it back, and we're going a little bit back and forth on this. And of course, our tenants are anxious to have their chairs outside.
I'll reach out to Chantel. I mean, there's benches in public parks that I see open, and there are some that I've seen sort of taped off with tape. So I think there is some confusion there.
Yeah.
My sense from Chantel is it's fine, but I'll check in with her and I'll send it out to the group just to be sure. Are there other? So I see Melody said the biggest challenge is resuming cards, bingo, and games. Yes, cards, bingo, and games. Those ones are a bit harder. I see Heidi smiling. Heidi, are there any activities in your space, and how has that been going?
Can you hear me now?
Yes.
Okay. Well, ARMS is Most of the tenants here are very independent. That's our building is, requires independency. So they often on like June, July, August, they take a break for a lot of the groups. So this kind of landed on really well with this COVID. So all the and many other activities are on summer pause. And we have a golden agers who do carpet bowling on Fridays. And we were trying to figure out how do you carpet bowl and clean up the balls and keep the distance. And we just kind of run into that. It wasn't working very well. So they're resuming hopefully again on September. So some of the groups which we could not find any logic way of doing, we kind of went on a break. There is a group who's holding patiently to wait when they can play bingo on Saturday. So we'll see how that works out. But there is a group who does like Zumba, but our common room is quite large, so the groups are small. So they've been able to do the like 10. There's maybe 10 participants, so they are scattered all over. We had a tenant who passed away last week, and she was known to almost all the tenants, and they had a prayer group each night in a common room. But they certainly has done so well with social distancing. There's never more than 25. Unfortunately, we do still have a rule, no outside people on a common room. So the family did not attend it. We just kind of stopped having outside people until further notice at the common room, just to reduce any kind of misunderstanding or any risk. But the tenant's been really good. Like they have done very good decision on themselves. So it's been good.
So Heidi, go ahead, Joanne.
I have a question for Heidi. So when your tenants met for their prayer time, did you have a staff person that was supervising that?
Well, we have always tenants who are kind of wanting to take the lead. And they're very good at that. They come and ask you what the policy is, and they're take upon themselves to make sure that it's all organized. So yesterday I had a little bit later night, so I kind of thought, well, I'll just go kind of take my mail and kind of do the little looking around the window, and it was so well organized. So there is always a couple tenants who take upon themselves to be responsible.
That's great. So my question to everyone is, as you read the phase 2 protocol, what is their interpretation as far as programming in our facilities and the need for staff supervision around it?
Anyone from Eden, as you're developing your policy, have you guys been looking at the phase 2 opening, or what? I guess your buildings are a bit different because they're not. I don't know if they're considered independent living. They're supportive housing, right? So there's a different.
Yeah, so they would have staff.
Kind of. Yeah.
We call it a supported housing program. So it's, yeah, people have their own apartments and their own lease, but when we do have programs, we're going to have 2 staff in each group, at least at Concordia Village 4. So, yeah, extra set of eyes, extra set of ears.
That makes sense. So staff are there. What about at Melody? You said the biggest challenge is resuming cards, bingo, and games. I don't know if you or staff are sort of involved in that, or if it's tenants organizing it, and how you might do that. And Andre, I guess you would be similar in an independent living seniors building if tenants do start up activities, how you would be involved in that. My sense from the document is that I think your responsibility hasn't changed, except as so you're not responsible for suddenly supervising programs, but you are responsible for communicating expectations and sort of checking in and trying to prevent that risk as similar to a business owner would be in a store, right? You're responsible for communicating information. If people in that building aren't following it, you should do what you can, but you shouldn't have unreasonable expectations on yourself. I see Melody says the coffee was organized by myself and I go in and check, but there aren't any other activities. Monique says in Steinbach, we don't really have supportive housing, but we have a somewhat drop-in program during the week with only one staff. Go ahead, Joanne.
Yeah, so where the coffee and these events are taking place, are you keeping a record of attendance, who is attending? That's something we've done. We've reopened our exercise room and we've limited it during staff hours, and we're having tenants sign in and for specific equipment or just that they're in the room. Again, in the event if someone does come in contact with COVID, that there's a follow-up of where you've been. So our groups, maybe Eden Mental Health, is part of your protocol going to be that you have people, you keep attendance or you have people sign in?
Yeah, we keep attendance at Concordia 4. Jackie or Nick would know about Steinbach if attendance is always tracked.
So Monique says, I'm pretty sure in phase 2 it states that you should be logging participants in case there is anyone that brings in COVID. Jackie says that's a good question. I know, Melody says they haven't started other activities, but you were asking about sort of people from visitors coming in. So that's a good comment about visitors, that there should be a log of who's coming in so that you can follow up if there's a bit of a tracing or tracking option. Monique says we have included in our draft policy that we also have people register for each activity. And Melody agrees, says that they don't yet have visitors in the building. Are there questions on outdoor or on tenant activities or visitors in the building, common areas?
So is anyone in an independent living facility having their visitors log in?
Melody says they don't yet have visitors. Andre says no log for visitors.
Okay. We're not logging in either.
Yeah, I think for Josh says the same, no log for visitors. I think for programs, visitors coming in might be different than someone going into someone else's apartment, because it is their home. Jackie says the same, no visitors and no login. Any other questions on that topic?
I have one more. So is everyone anticipating then with phase 3, they're going to allow us to play games? Is that when we're anticipating seeing that?
I'm hoping for it. This is
Okay,
Josh.
you're hoping. Okay, okay. Okay.
I heard that they are preparing for sports, like they're preparing for baseball and so the games would sort of fall under those categories.
Okay.
Okay, we'll keep an eye out for that. So I see there's a couple other questions or comments around Lawrence commented on the rent freeze, and Heidi, you asked if there's any updates on that. So we haven't heard any updates. When we had the question and answer with RTB, they clarified that hearings can start up at the end of June, but those hearings will be for anything that was in place prior to the moratorium on evictions for anything besides immediate safety risks, as well as the and the rent increase freeze. Those were an amendment that won't change until the government lifts that amendment. So there's no time frame attached to the rent increase or evictions for anything other than immediate safety issues. But they are resuming hearings for anything prior to that. And so Lawrence made a comment that he had a call from RTB asking about rescheduling hearings. They didn't have a date when they would be starting, but they're trying to get an idea of how many hearings they may need to schedule. So they're trying to plan ahead, and so this indicates that this ban may be lifted soon. I've seen a couple of media articles about it too, so it sounds like that may be true, that they're considering lifting it. I haven't heard anything else about that. Has anyone else heard anything about the rent increase freeze or the evictions? We do have a survey out that I encourage everyone to participate in. We did tell RTB that we'd try to get a sense of expected needs as this, in particular, any sort of need for mediated agreements, so that they can schedule and provide the staffing necessary. So if you haven't filled in that survey, please do. My sense is that there isn't, from what I've heard from folks, there isn't that much more demand than there would be in a typical time, there haven't been any fewer, generally, especially in the seniors buildings, fewer people paying rent, for example. But the gap means that there's some demand that has been sort of building up over time. Any other comments on the rent increase freeze or the evictions RTB needs? We do have the Q&A from RTB on the website, and they said, for example, if you typically are raising rent in a particular period, you should follow those standard procedures still, so you can still provide notice that rent increases will be in place, so that you don't lose your annual date when you typically do that. You just can't actually put it in place until the amendment is lifted by government. So we'll keep an eye on that and share any information as we hear it. So then let's go on to Dean's question. Dean was asking about sort of the building itself, and if anyone's considering any changes to the building, or considering any, if you're either new development or changes to your existing building, maybe things that you would do differently now that this has happened, to deal with Dean, you just have to unmute yourself. There's the mute button at the bottom. Or C, got it. Okay, go ahead, Dean.
Thank you. I was just wondering whether groups had considered setting aside areas of any particular building that families might have as a meeting space that could be recleaned after use, that would sort of assist in bereavements or folks who are ill within the building. but not going to any other facility. I know it's a question of containment within this whole COVID arena, but I just wondered whether there's been any thought as well into some of the situations where the government is, I think, going to have to look at, because we are, as Memphis, involved in the province's desire to place some of their facilities under Memphis control, whether there's any ability or thought going onward into this kind of a situation where we might have a meeting room, we might be able to have some separation in there, but common areas for families to meet that might not be possible in any other way.
So any changes to the building or the space that folks are considering to allow for families to visit, or for sort of if people are sick to go to sort of a, I don't know, a self-isolation sort of location? Anything folks have considered?
I guess what's happening in our building is with the changes, with the home care changes around non-essential services, it's our families that I'm observing are primarily picking that up. And so they're entering then the tenant space, which is a safe space for the tenant, and practicing, social distancing and hand washing within the tenant. So that's one way I see our tenants and their families are practically doing it. And again, they're also being really resourceful in meeting outside of the building. And the odd tenant, I can just think of one situation where a family member will sit in a common area with a tenant for a short period.
So families are stepping in the absence of home care. We hope that that won't continue, or won't need to continue. If family can do it and want to do it, that's a different story. Most of our MAMFA members typically are not like personal care homes, or we have a couple of assisted living facilities that are doing different things when it comes to buildings, I think, compared to I think folks on this call. I know 1010 St. Clair, it'd be interesting to ask them if they're reconsidering any of their space, because they provide more attendant care and their staff are providing support for folks.
Yeah, something else we're looking at is maybe adding some tables to our outside space.
They're creating more outdoor locations for people to meet. I know Rob from Westman Lyons was thinking about some technology improvements to their building. So he was asking about automatic temperature monitoring, for example. And he's been looking into some no-touch door openers, so that reducing the amount of people needing to touch things. Other building related things. I think first, I think Dean, your question's a bit far ahead in advance. People, as they're doing renovations or repairs or developing new, might have different considerations.
I think also, though, that as we're talking about and thinking about as a larger society, that all across the country, if we have a second phase of this, it's going to interpose on our constituent residents probably a second degree of I don't like to say loneliness, but a bit of hardship, and wondering about ways within facilities that we can overcome that.
Yeah, that's a good, an important concern. I think tenant isolation and loneliness. I saw that the Long-Term Care Association was doing a tablet collection so that they folks to communication devices so that they could be more engaged with family and friends. So trying to, I think we shut down suddenly. It was unexpected. We have been cautious. Thank goodness we've managed to avoid any of the tragedies here in Manitoba that we've seen in other parts of Canada and the world when it comes, especially to personal care homes. But just because we've managed to keep people safe from the pandemic doesn't mean that people aren't still struggling and needing that interpersonal connection. We'll keep that on the radar. We've been thinking about having a session on tenant connection and supports, so and mental health. So thinking about how we might continue to do that. And clearly, the demand for programs shows that people are craving that that human connection. Other comments related to building design or space to deal with this. I think Dean, I'll also connect you. There's a couple groups I know of who are thinking about new developments, and this might be more on their radar. So Springfield Seniors has been looking for a while at developing some assisted living, and as is Sokol Manor in Brandon. So they may have some other comments on this. So the other, I want to make sure I covered everyone's questions so far. Distancing groups. Oh, business account for CRA. Joanne asked about a business account for CRA, if anyone's done that or set that up. Does anyone have access to your business account for CRA and remember how you got it? We can ask some bookkeepers. Joanne, I have access to our online CRA account, and I remember that I had to submit a letter on letterhead demonstrating that I had the authority to become a representative. So I don't log in under the business account. I log in under a representative, and our bookkeeper also has access to that. So I can try to figure out how. It was a while ago, but I know I did it, and I know it was a bit of a hassle, but I'll try to figure that out. Has anyone applied for any of the government programs or supports? I did have a call from someone about the emergency or the what's it called, the provincial risk recognition program, which will provide any staff who have been making under $2,500 a month with a certain, they don't know how much, it's going to be sort of divided up by the eligible applicant. So folks should be applying soon because I think it's due June 18th. I saw Heidi nodding. Have your staff have applied for that?
I applied it for our part it's not a full-time job, and we calculated that her hours were just 15 hours above the required. So we did the application online, and it was actually really simple. And it was more work just to calculate that she had enough hours. But otherwise, the application went on last week, and now we're just waiting and see. The other employee wasn't qualified, but yeah, we put the application in and see how it works.
Great. I'm glad it was simple. I did see the premier said something strange. He sort of, because people were complaining that the $2,500 a month limit is a bit unfair because it doesn't recognize a lot of folks who are taking a risk. And he sort of said, well, everyone should just apply and we'll figure it out. That is an odd response, because that means people won't apply if they don't see themselves as eligible. Heidi, do you know, like, is there something in the technology of the application that would prevent you from applying if you're not eligible?
Well, I think it really walked through very well. It had like a questionnaire first. So it kind of asked, like, where you working, and like it kind of walked through, and then it says, okay, well, now we'll fill the rest of the form. So it kind of gave you the idea already whether you were qualified or not.
Okay, that's great. So it does have a bit of an eligibility screening. Yeah. We have, Carolyn Ryan did say, if we have concerns as a sector that there are folks who have been at risk because of your role, but are making a bit above that limit, and that's a concern, to let us know, and then, or to let her know, and she'll sort of bring that up the decision-making chain. So if there are folks who you think should be eligible but aren't because they're making, $2,600 or like close to the limit, but there are problems, please do let us know, and we'll collect that and submit that together to the government by the deadline, and then we can see if they would consider some changes. The federal programs have evolved substantially since they were first announced. The CERB, for example, there are hundreds of thousands of people eligible for that who weren't eligible when they first announced it. So don't hesitate to raise those issues at this time. I think government's trying to do things quickly, but not perfectly, so we can make improvements as we go. Anyone else accessing any of the funding programs from government? See anything? I saw that there is the provincial government also announced a summer student program recently, and they are encouraging nonprofits and charities to access that. I think it's up to $6,000 to hire a summer student. So if you want a student to take on some programming supports, or gardening, or activities, or I don't know, administrative stuff, developing policies, you'd have to be careful about what student you hire to do that. But it's a good opportunity. So we've covered all the questions that people had in advance. One of the questions that I had, I know we talked about it a lot on the last call, is whether or not people's offices are now open to people coming in. I think a lot of the folks on this call never actually closed your offices to tenants, or have been continuing to go into your offices. Have you guys made changes to your offices and how you interact with residents in particular? And has there been anything that you've learned from that? Jackie says the office in Steinbeck has stayed open. Joanne, is your sort of main reception area, has that changed at all?
Yeah, we've stayed open the entire time, and we've taped off, and we just received our new clear screens for our front reception desk, so we're happy to take down the tape. And we also got stickers that we'll be placing in numerous areas to remind us to social distance.
Stickers and plexiglass screens?
Yeah.
I see Melody says that the office in Brandon has stayed open. Andre says we stayed open, kept one chair, and kept social distances. And Jackie said that the office in Steinbach has had few visitors, but they've stayed open. The other question I had is whether or not people, a big concern people had when we first surveyed folks around the COVID-19 response was that people were looking for supplies, in particular PPE and disinfectants. I was wondering how that's been going. Are there still supply needs that people have that we can support with, or have people found everything that they need? Joanne, was it easy to find the plexiglass
Yeah.
screens?
Yeah.
Yep.
Yeah.
We have a pretty good supply of PPE as far as like the equipment that staff are wearing right now. Somehow we were connected with a very generous donation from Canadian Tire for some, I believe they're classified as a procedural mask. So yeah, we certainly welcomed that. And I don't know if that opportunity is still out there for other people, but yeah, they were very generous.
Great, so check it out, the Canadian Tire program. I see Andre says Home Hardware in town was able to get many of their required supplies. All right, we found PPE and we found the supplies. Jackie asks, what is the procedural mask, Josh?
Face mask. Yeah, it's a three-ply product, and we received a number of boxes with 50 in each. So we're well set for our face-to-face meetings, as we're needing to wear those for that process right now.
Okay, and those are the disposable ones?
They're disposable. Yeah.
So the disposable, sort of like the surgical mask.
Yeah. Yeah, I don't think that it's quite surgical grade, but
okay.
Yeah, yeah, it's just a disposable, recommended single-use only.
Disposable single-use masks. Check Canadian Tire. See, I'll check their. I'll see if I find any links to their donation program. I'll share that. But if not, I think there are other places that have them either for sale. I know they were saving them. Typically, when you went to order them in the past, they would say they're saving them for particular industries, including healthcare. So there may be a need to demonstrate why you need that. But I think if you are providing supports within housing for an at-risk population, I think you could make the case that you qualify for those. If not, I know Chantel from the WRHA said the reusable fabric masks are. And we did have some information in that call, and so in the documents on how to use masks. So that's becoming more clear for folks. So we've talked about tenant services, government programs. Oh, I had another question about HR policies. And if anyone has updated your policies around the need for self-isolation and sick leave. I know as a executive director, I was thinking we should do that. So I wondered if anyone has updated their HR policies to respond to COVID.
We haven't made an official policy change, but staff has been advised in regards to future vacation or vacation plans that they need to follow the provincial guidelines of self-isolation, and it would be an unpaid leave.
Okay, so if people take vacation out of province or out of country, and they need to self-isolate, then they need to follow the guidelines, and that's considered part of their either vacation if they have it or an unpaid leave.
Yeah.
Anyone else? Monique says they have, but have to look it up. Yes, if you could forward that to me, that would be great. We can share those policies. We do have the board toolkit, which has some policies. I guess an HR manual is kind of part of board and part of operations in between, depending on what your staff positions look like. But we can share that with folks. I think it's always good to have sample policies. I just see, so Martha, I think maybe is one of the call-in users. So she has said that staff were working around the clock during COVID, worked on serving seniors, including housekeeping staff. But no one qualifies. Okay. So no one qualifies for the, so although staff are working around the clock, helping tenants during COVID, none of their staff qualify for the risk recognition program. So let us know if there's any information on if the amount will be changed. Martha, I'll talk to you after. Maybe we can put together a letter with some of the specifics, and we can send that to government to see if they could change the amount of the risk recognition program. HR policies, we've talked about RTB, talked about financial impact, about design. That's everything that was on the agenda. The last question I had is if there are other education needs or Q&As that you'd like us to put together to support you at this time. So I saw some nodding heads and a comment that it would be positive when we're talking about tenant isolation and supports for tenants. Are there other questions that you have, experts that you'd like us to get here for a Q&A, other issues that you're facing or anticipating that you would like us to put together in the coming month or two?
Hi, Christina. It's Dean. Just a thought with regard to the stage 3 opening that's hopefully coming soon. Has there been any CRHA input into how they are going to try to address opening within any of the food service programs in Memphis buildings at all, or in PCHs or otherwise? I'm thinking of single service items in it, as we spoke before about tenants touching cards or games or things like that, how this will affect us in the opening of cafeterias.
That's a good question. Opening cafeterias and meal programs, how that can and should happen. We haven't had any input into that. They haven't asked for any input on much, but I can put something together if folks have comments. Are you suggesting that there may be a need for additional resources so that you can either have additional staff or pay for the additional supplies associated with reopening meal programs?
Well, if we have an idea of the requirements that they're going to request of us, then perhaps we will have a leg up on time frame to be able to acquire those things.
All right, so asking them to have some clarity and specifics on meal programs, knowing that that you'll need additional supplies and you'll need time to prepare accordingly.
Yes.
That's great. I will. I'll look into that and try to find out if they have more information or ask them to include more information on meal programs. And we could potentially have a Q&A once that opens up with public health about if they do have some guidance on cafeterias and what that should look like.